Namaste friends, my name is Rajesh Chadav and I am a psychotherapist, a word therapist and a counselor. This is my 7th YouTube video and in this video I am going to talk about depression. I am sure everybody of you might have heard this term called depression, but very few people knows what depression is all about and what it can do to a person. Depression is a very hidden kind of mental illness or psychological disorder. Any person can suffer from depression and yet that particular person might not be knowing that he or she is having depression. Even the family members and the close associates of that particular person might miss out the signs and symptoms of depression in that person. Often when a person suffers from depression, many a times people jump to the conclusion that this particular person might not be doing well in their life and that is why they are suffering from depression. Let me tell you, that's not the exact reason. Depression can have numerous reasons. Even the richest person can suffer from depression. Even the most successful person can suffer from depression. Even the most richest person, the successful person, the most powerful celebrity star can suffer from depression. So, depression cannot be categorized with one reason only. It can have various and numerous reasons. Depression has a strong connection with the overall personality, the mindset and the thought process of a particular person. Everybody of us goes through downfall in our life. But then how do we take the ups and downs, the good time and bad time and the downfall in our life has a strong connection with depression. Many a times people are not able to take the downfall in their life in a positive way. Many a times people cannot handle the difficult moments coming into their life in a courageous way. Many a times people only want happiness in their life. The moment sadness enters their life, they cannot handle those sad moments and all these reasons can lead to depression. Many a times depression is compared with the feeling of sadness. Let me tell you, depression is just not restricted with the feeling of being sad, but depression is far more bigger and different from sadness. Let's try to understand this by taking an example, like how in a particular situation a person who is normal will react and how in a particular situation a person who is depressed will react. For example, say a normal person, a normal man loses its job and had a relationship breakup. Obviously this person will feel very sad. But maybe after 5 days or 6 days, slowly and gradually this person will start regaining within his life. This person will be able to understand that good time and bad time is a part of life. Life is full of ups and downs. Such moments like losing the job and had a relationship breakup will not be the end for this person. And then he will accept the fact that wrong did happen in his life and he will get back to the normal life, to the normalcy and will start performing his day-to-day activities again and he will be able to move on in his life. Now let's talk about how a depressed person will react in this same situation. Suppose a depressed person loses its job and had a relationship breakup. Obviously the depressed person will also feel very sad. Days will pass like 5 days, 7 days, 2 weeks, 3 weeks, 2 months, 3 months. But even after such a long time had passed away, the depressed person will not be able to get back to the normalcy. Losing of the job and going through a relationship breakup will be like the end of the world for a depressed person. With the passing of every single day, the depressed person will go into more and more depression. His sadness will start becoming more and more chronic and acute. A depressed person will not be able to understand that good time and bad time are part of life. Ups and downs are part of life, and we all go through these ups and downs. For a depressed person to handle these moments will become very, very difficult. The depressed person will start losing its hope, and getting back to the normalcy will become very, very difficult for a depressed person. The depressed person will not be able to do the day-to-day activities, and he will start losing his hope, and life for him will start becoming worthless. So this is a major difference between feeling of sadness and a person undergoing depression. Why I gave this example? Because often people compare depression with feeling of sadness. Sadness is a very common emotion which everybody of us goes through in our day-to-day life, and then immediately we get back to the normalcy, we get back to the normal life. But in depression, a person will not be able to get back to the normal life. A person suffering from depression will not be able to perform the day-to-day activities. Also, when I say that depression is a very hidden kind of mental illness or psychological disorder, I want to talk about this in detail. When asked to a person who is suffering from depression that since how many years you are experiencing depression, they come up with a time period. They may say like 2 years or 3 years or 4 years. Even their family members say the same thing. But let me tell you, that's not the reality or the actual years of depression from which they are experiencing the depression. The numbers which they are saying are the numbers of those years from which they have started experiencing depression in the acute or the chronic level. Because in the chronic level, depression is seen outside of the body, that is within the personality, within the talks, within the behavior of the person. In the mild level, it is always hidden. So when they say something unusual on the outside of the body, like within their talks, how they feel, within their behavior, within their personality, that's the time period from which they think that they are suffering from depression. But that's not the reality. Maybe when anybody says they are suffering from depression, say from 2 years, 3 years or 4 years, it might happen that they might be suffering from depression since last 8 years or 9 years, or say maybe more than that. Because the mild level of depression is very, very hidden, and silently it increases within any person. That is why I say depression is a very silent and hidden kind of mental illness and psychological disorder. Now let's try to understand the signs and symptoms of depression. A person suffering from depression, the major sign and symptom is that particular person will stop communication with its own family members, with their friends or the close associates. A person suffering from depression will avoid the public places. He or she will not feel like going to the public places. They will prefer staying at home, and that too locking themselves within their room for long period of time. The another sign and symptom about depression is a person suffering from depression, when they woke up in the morning, they do not feel like getting out of their bed. Instead, they will continue lying in their bed and keep staring at the ceiling wall or the fan or the curtains for a long period of time, and this period might be in hours. And if you ask them what they are thinking, they will avoid giving the answers. They will get irritated or they might get angry on you, but they will never tell you the answers. You will always find a depressed person always thinking on something or the other thoughts. They become overthinkers. If ever the depressed person is working or having a job, then they will not feel like going to the job. Instead, they will take up a decision to resign from their job and stay at home. The thought process of a depressed person will become confused and they will not be able to take proper decisions. They will start becoming hopeless in their life. All those activities which they used to like and they used to perform in the past, they will start disliking all those things and activities. The performance level of the depressed person will go down. They will not be able to perform in their day-to-day activities. Even a small task will become a big difficulty for them. And slowly and steadily, they will start getting the thought of worthlessness. They will start thinking that like why they are living life, their life is not worth. And then this will get them the thoughts of ending their life by committing suicide. So try to understand, depression is a very serious kind of mental illness and psychological disorder. Often mental illnesses are not openly accepted in our society. People have a lot of discomfort, shyness and social stigma when it comes to the acceptance of mental illness. This is one of the main reasons why people do not want to treat their mental illness and always want to hide their mental illness. People only go to treat their mental illness when mental illness enters the chronic or acute stages. There needs to be more and more awareness about mental illness. People need to understand that the way a physical body can fall ill, same way a mind can fall ill. To treat the mental illness, acceptance of the mental illness becomes very important. How to treat depression? The mild or the moderate level or stages of depression can be treated with psychotherapy, which is the talking therapy or counseling. To treat the chronic and the acute level of depression, one requires to approach the psychiatrist and take the medication, that is the medicines. Why medication? Because in the chronic or the acute level of depression, the physical part of your brain gets affected. Also, the level of happy hormones becomes very low. So, taking the medicine becomes important to treat depression in its acute and chronic levels. Many people think that just by taking medication or medicines, their depression will get fully treated. No, that's not the case. Why? Because the root cause of your depression is not the physical affected part of your brain. Instead, because of the depression, the physical part of the brain got affected. So if you only take the medication, the physical part may get treated, but the root cause of your depression, which is your mind and your thought process, will remain untreated. And that is why to treat depression completely, you also require the psychotherapy, that is the talking therapy or the counseling. In short, to treat depression, that is to treat the mild or moderate levels or stages of depression, you require the psychotherapy, which is the talking therapy or the counseling part. And to treat the chronic or the acute stages of depression, you require the help of a psychiatrist as well as psychotherapist. I myself, I am a psychotherapist, a word therapist and a counselor. If you find any of the signs and symptoms from this video within your family members or friend circles or anybody whom you know, please encourage them to go for the treatment for their depression, because depression does not get treated by itself. You can always give me a call or send me a WhatsApp message at this given mobile number. Thank you so much.